everyone. Thanks so much for joining me for this week's episode of When I Grow Up. On today's episode, it is my pleasure to welcome Dr. Hyewon Lee. Hi, Hyewon. How are you?
Hello.
Thank you so much for joining me today.
Sure.
You are. I did say Dr. Hyewon Lee. So I know that you are a dentist. Is that correct?
Right. I'm a pediatric dentist.
Pediatric dentist, yes.
Mm-hmm.
I'm just meeting Dr. Hyewon today through a mutual friend of ours. So I'm excited to listen and hear more about what it is that she does. So Hyewon, can you tell me more about what it is that you do?
Sure. So I have to say I'm a little bit different dentist. So after I graduate dental school, I joined a service. So I was in the uniform service for 4 years and working on the policy level. So it was managing dental program in community health center across the nation. And then I started my pediatric residency and some research. My research topic is about pregnant women, how to make their teeth healthy and their baby's teeth healthy. So my daily routine, like my weekly routine is 2 days I teach residents in hospital as a faculty. And for 1 day, I see my own patients. And 2 days I'm doing research. So I'm a little bit of everything.
Oh, wow. Okay, I have so many questions. So,
All right, go ahead.
So you said that after you joined the service, do you mean like the military service?
We call it uniform service. I was not deployed to like other country like Army or Air Force. It's like 6,000 of doctors and nurses. It's called the U.S. Public Health Officers. So we are deployed to like prison or Indian health service or community health center where usually doctors and nurses are very like short. So we are serving most underserved population within U.S.
Oh, wow. I had no idea that was even a thing. So this is like a government program, though?
Right. It's a government program. We are wearing Navy uniform. So we are in the service and we are deployed if there is any disaster within U.S., then we are going in and helping people. But our daily routine, for myself, I was posted in the Washington, D.C. Department of Health and Human Services. My job is more like policy analysis. But other dentists, they are usually deployed for clinical services in prison or Indian health services.
Oh, wow. So can I ask you why you chose to do that?
I didn't choose. It happened.
Oh, really?
Yeah. So a little bit back in history, I always studied art, middle school, high school. And then something happened. There was a huge financial crisis in Korea a long time ago. And then both my mom and dad lost their job or businesses. So I knew that I cannot continue studying art or become an artist. And then that's the first kind of life crisis that I asked God a question about, like what kind of person I should be or what kind of career I should pursue. Because besides arts, I never thought of other careers. And then, inside voice, God was telling me to become a doctor, and which I never thought about before. But I obeyed and I followed. It was a long story, 14 years. And then I went to the dental school. But I have to say I didn't really enjoy studying dentistry or medicine because I was always like art person. But second year of my dental school, when I start to see patients, I really loved it. I loved the interaction, like educating them how to take care of their teeth, helping them to go through all the insurances to give them the best deal within the dental school and all those. And I loved it. And my patients loved me too. So I didn't regret and I was happy that, I never tried before. So I didn't even know that I liked it. But I was in the situation that I kind of forced into it. And then I found that I really liked it more than arts and other things.
Oh,
And
wow.
then when I graduated dental school, there was another huge financial crisis in US
Mm.
um, in 2008,
2008,
2009.
yes.
Right. So it was very, very hard to find a job. It
Mm.
was a season of firing, not hiring.
Yes.
So at that time, um, after dental school, about half a year, I couldn't get a job. And then I prayed and I waited for opportunity, and I got a opportunity from some people in government. So I presented my work during my dental school, the last year in dental school, and I went to a conference and I met some people, and then they kind of noticed me that I have a heart for underserved.
Mm.
So I got an interview, and then I got hired at the federal government, Department of Public Health, and then I started my career there. So it's quite different from other dentists because they usually do clinical work, and later in their life they may do some other things. But I started right there, right after dental school, the world of policy. So that was pretty amazing, eye-opening, very steep learning curve. But again, I found myself, I really enjoy it. I never tried before,
Mm.
but I was in the context and situation which I didn't plan for, but I loved it. So I pursued my additional degree in public health. I did a master in public health and doctor in public health, and I become a dentist in a public health context.
Wow, that's incredible. So, like, I mean, some things that come to mind that I'm really curious about is, you said that you studied art for some time before going
Yeah,
into dental school, which,
yeah,
and that you mentioned that it was kind of, you didn't love it in the beginning, but so you said the big thing for you was the patient interaction that you
right.
found that was valuable to you. But
Yeah.
even then, like, do the sciences come naturally to you, or do you feel like as somebody that loves art, you had to work a little bit harder?
Harder.
Oh
Way harder.
man.
Yeah, my major, by the way, my major was psychology, behavioral psychology when I was in college, um, because I knew that I will go to some medical or dental school,
Mm,
but I knew that I'm more like that kind of person, like
sure.
literature, arts. So I really try to work on it in the college level while I'm doing my pre-med stuff. And I love the psychology. And when I get into dental school, when I didn't find itself quite interesting the first year and second year before I start to see patients, I tried twice to quit dental school because I didn't really see a fit for me.
Mm,
And I didn't really enjoy the material, but I did it. I did
mm,
it diligently.
mm.
Um, but I could not see myself doing this for the rest of my life.
Ah,
But it wasn't just a part of becoming a doctor, the science, the chemistry, the biology, anatomy, all those, which I need to know well to become a doctor. But once I start to see patients, it was pure art. How to educate them, how to encourage them, how to inform them to choose the best treatment plan based on their limitation, finance and everything. So it was a lot of psychology there, a lot of counseling there. And that's why I became pediatric dentist too, because I love to talk to mothers and fathers.
wow.
While I'm doing my clinical work for the kids, I can talk to parents and educate them so that they will not have cavity and come back to me again.
Wow, that's so cool. And I think I appreciate it more because I'm a parent and
Mm,
we've been to the dentist and it is horrible.
I know. It's not a pleasant experience.
But I understand what you're saying too about it really is like trusting my dentist for my
Right,
children, right?
right,
Um
right.
for and the best course of care for their teeth and stuff, and I want to be able to trust
Mhm.
you as a dentist, and I that makes complete sense.
Sure.
um can we go back and talk about you mentioned that you did some policy work
Hmm.
for the United States.
Hmm.
um like what does that mean?
Right. Let's say, let me give you an example. Um, so in a community health clinic,
Mm-hmm.
compared with a private clinic, so they accept Medicaid, those public insurance, but they have a scaling fee schedule, which means based on their income, the clinical service, which is the same, like same billing, same extraction, the fee can be different by income. So that's kind of a safety net for the people who cannot afford regular dental care at private clinics, right? And then there's a lot of languages and legal stuff there, like which services is covered and which
Mm-hmm.
service is not, for example. So for children up to 18-year-old by Medicaid, everybody is covered if the children is enrolled in Medicaid, all the dental services will be covered and sometimes even braces, right? But for pregnant women who are enrolled in Medicaid, it really depends on states. For example, like Tennessee, Delaware, they only covers some like emergency care or sometimes nothing, and it fluctuates. But states like New York, where I am in, it covers a lot of services up to root canals and other services.
Mm-hmm.
So having this policy, having this language in place, those people who cannot afford regular dental care, actually they can get a benefit through the public insurance if there is a policy. And for now,
Wow.
for pregnant women, it's really different state by state. And my research is focusing on generating a lot of stories and outcomes that having this kind of policy for pregnant women who are enrolled in Medicaid is important to secure their oral health and their baby's oral
Wow. That's crazy.
Isn't it?
Oh my gosh. Then yeah, that's insane. And I again, I can just relate to this cuz I've
Mm,
been through, I can't imagine. Like I mean, I have my the private insurance and I'm not under Medicaid, but um that's I mean, I didn't realize it would differ from state to state. That's crazy.
mhm,
Okay.
mhm,
So you would work on these policies with your colleagues and then try to
mhm.
push these policies through?
Well, I was at more like a beginning level,
Okay.
entry
Okay.
level officer
Uh-huh.
for 4 years.
Okay.
And then because there is not many dentists in the policy or public health world,
Interesting.
yeah, because like 95% they are going to private clinic
I
and
see.
very few of us going into public health career path.
Okay.
So I could myself promoted pretty fast. And
Oh.
then I questioned and doubted myself. You know what? I never have been really working in the real field. And I kind of, put it into this public health world right after dental school. So what I'm doing, like creating these strategies and policies and all the regulations, I may not know what's really happening in the real world. So I talked to my husband and I talked to other people. I know that I get promoted pretty fast in this world, but maybe I need to learn about the real world. So I separated from service after 4 years,
Mm-hmm.
and then I started my residency, pediatric dental residency, which was purely clinical. And I
Mm.
chose Mount Sinai Hospital because I know that I will put into Harlem, which is one of the most underserved area in Manhattan. And that's where I see the real problem in real setting.
Wow.
So
Wow.
I could relate what I did in policy world to the real clinical world. So it's not just talking over the tables, but I can put faces over the numbers
Yes.
and the policy languages. So I think now I have in the position that I know about how the policy work and I know how these underserved mothers and the children's have the barriers in accessing care. And then after my residency, I did a couple of years of fellowship in research
Mm-hmm.
where I can use my research skills to really move my agenda forward, which is to cover everyone, including the have and not haves, to have adequate and timely dental care.
You're a superhero.
I am
Oh my
not.
gosh.
I
I
just started.
but even then, man, like that is incredible. I'm very inspired right now to like, like be able to, I think it's just special for you to say that, this is what I want to see happen, and you made moves to to be in that world in
Mm-hmm.
order to change the system. And it just speaks volumes to me. So
Right.
thank you so much.
Thank
Like
you.
really.
I'm trying. I'm trying.
Yeah, yeah. Um, I did find it interesting that you said that your research is in for pregnant women and
Mhm.
pediatrics. Is that what you
Right.
said?
Yes, yes.
Why is that? Is there something I don't know? Is like why specifically pregnant women?
Yeah. So, as you know, as a mother,
Uh-huh.
decides many things for the young kid:
Mm-hmm.
what they eat, how they brush, what kind of snack, how often they are given snack, all those things. So, when I work in Harlem, the clinics in Harlem, I see very healthy 3-year-old, 4-year-old with lots of cavities, a lot. And
Mm.
sometimes these kids are too young to receive treatment on dental care. So unfortunately, the last resort is to give them a general anesthesia in the hospital setting, and we treat all the cavities under general anesthesia, which as a mother I really want to avoid, but sometimes it's just their last resort. And then after I finish my surgery, there, for example, there was a 5-year-old perfectly healthy during my residency, and there was a very loving mother from Holland. And then I asked to mom, like, why? What do you think your son has so many cavities? And baby teeth, there are 20 baby teeth. And because he had so many dental cavities and abscess in the mouth, we had to wiggle out 18 out of 20 teeth. 5-year-old having only two back teeth left. I was wondering, how would he speak or eat properly for next few years? And as a mother, I was devastated. And I didn't know how to explain this to the mother. It was definitely disease free, but I
Mm.
was not sure if I can say it's a healthy status, right?
Okay,
And
yes.
I feel guilty too. I'm somewhere from age 0 to 5, someone had to tell this mother how to take care of her son to have a healthy kid, healthy mouth, and healthy teeth. But
Mm.
she didn't know. She was a loving mother. She was not like
Sure.
neglected,
Yeah.
but because the son has some digestive problems, so she was giving his son a lot of ginger ale. So that was the main culprit, that he had so many cavities. And she did not know that the ginger ale, the carbonated like soda with lots of sugar, can create that much cavity and he need to lose that many teeth.
Wow.
So
Wow.
all those incidents came up to my mind. And you mentioned about the system. The current dental care system, the dentist can be paid if they do the treatments, right? But I don't get paid when my patients become healthy or cavity free.
Right.
So it's a systems problem that providers should be incentivized when the patients became healthy, not only they do the drill and fill.
Yes, I didn't even
So,
think about that. You're right.
right, right. So that's my, I think, career agenda, that I really want to see
Mm.
healthy kids, not just so many
Mm.
cavities. Oh, this is a perfect feeling that I did today. Well, there
Sure.
is a rewarding feeling there, but ultimately, what I want to see is a healthy um, smiles and healthy mouth, not just lots of feeling.
Mm. Yeah.
Mhm.
I see. Man, that there. I can't even imagine that situation as a mom. And you said it well that I as a mom too. You're looking at this 5-year-old. Like what
Mhm.
happened, and
Right.
man, that is insane. So, I have a random question for you
Sure, go
before
ahead.
we continue our conversation. Is it true that pregnant women are more prone to cavities during their pregnancy?
Depends. So pregnancy is really different by different women.
Uh-huh.
Some women are craving for sweets, then there will be definitely higher chance to get caries. Some has more morning sickness, like acidic environment in the mouth, then yes, higher chance to
Oh,
get caries.
I see. Okay, that makes sense. I had terrible morning sickness, like really bad.
Mm.
I threw up for like 6 months. It was
Oh,
horrible, but um, I have never had cavities until
that's good. That's good.
after I gave birth, and then I went and they told me I had four, and I was so shocked. But then someone told me it was like something about the calcium. I don't know, but I didn't know what that was. But
Yeah, and most importantly, what I think it's really amazing and also really scary thing is there are lots of research confirming that if the pregnant woman or mothers have active untreated dental caries,
mhm.
there is 3 times higher chance that the child will get cavity in an earlier age. It's
Really?
very important during pregnancy to take care of dental caries to prevent dental caries for the young child.
Really?
Yeah.
I'm so shocked right now.
Yeah.
Interesting.
So in 2012, when I was in Department of Health,
Uh-huh.
the U.S. government published the U.S. national guideline for oral health during pregnancy. So before 2012, the provider was told that yes, you can do the fillings and other dental treatments during the second trimester only, right? But
Right.
this publication clearly said it worked from CDC, NIH, FDA, everybody gathered together over a year, and I was there too. And then it was clear scientifically we can do any treatments during any trimester in a safety
Mm.
measure, with a safety measure. So this guideline clearly say what is a safe dental care for pregnant women, what needs to be avoided, what kind of medication to be avoided, local anesthesia, all those. But most of the dental care can be delivered in a safe way. And actually, the benefit of having no cavity mouth, it outweighs the risk of other things.
That's insane. I never, that is, wow. I'm sorry. I'm just very, this is all very fascinating. I'm
It
really
is.
shocked, actually.
Not many people know. So on the side, I'm educating pregnant women, including pregnant teens in
Oh,
my
wow.
hospital.
Yes.
Why is it important to have a healthy mouth before they
Mm.
deliver baby? Because they will definitely kiss the baby, definitely share utensils and all those. And then they are sharing their germs as well. So I make sure that those pregnant women and pregnant teens have a healthy teeth and healthy mouth before they deliver baby.
Wow. Wow. Um, you know, a lot of or Korean households, I feel like don't go to the dentist growing up. At least I did
Mm.
not. I didn't go to the dentist a lot growing up. I had to ask my parents, "Can I please go to the dentist?"
Oh, that's
um,
good.
but do you find that to be true?
um, it's really interesting. Yeah, I mean, dentistry somehow has been separated from the medicine
Yes.
historically. Yeah, from the
Yes.
training level, dental school separate from medical school, dental insurance usually not included in the health insurance, all those.
Mm.
But even when when I went to my dental school in Boston, Boston area, they are super smart. Those are PhD from MIT, Harvard. Those were my patients, but they were not aware of how important oral health is.
Right.
And they were not changing toothbrush regularly. They were not brushing their teeth regularly. So it's not just the literacy level, but their awareness level about the importance of oral health. And oral health has been like a second child for a long time. So we are really trying to emphasize that oral health is health and it should be considered as a primary health. I'm not
Mm.
talking about implants and all the fancy aesthetics, but those, prevention and all those, fillings and basic dental care should be considered as a primary care, not a specialty care.
Yes. I
Mhm.
think that's how I think of it, honestly, is like
Mm,
that like going to the dentist is secondary to my
mhm,
physical health. But
mhm.
I'm learning more and more that that's not true. So,
Right, right.
um, you mentioned also that you are a professor, like you teach.
Yes.
So what is that like as a profession for you? What does that how do you prepare for those teaching times and
Mhm.
um yeah, like what is it like to how many do you teach residents? I'm sorry, I forgot what you said.
Yeah, yeah, yeah. So I'm in the Department of Dentistry and I'm a pediatric dentist.
Uh-huh,
So
uh-huh.
I have my pediatric dental residents who are already
Residents.
dentists,
Okay,
but who
okay.
wants to learn more about how to take care of children's
I
teeth.
see.
Yeah, so I teach them the clinical stuff, how to drill, how to make silver crowns and all those. But at the same time, I teach them how to create a research design because even though like private doctors, private dentists, they still need to question about the clinical guideline because it's evolving all the time. So
Mm,
what is true 10 years ago, we have a better materials now, better techniques now. So they still need to continuously learn about those.
mm,
So thinking about those and having a question, that's the beginning of research. So research is not just like daunting topic that I'm a clinician, I'm not going to do research, but it's about asking question. Am I delivering the best care to my patients?
sure.
That's the start of the research question, and that's what I teach to my residents. And I do
Wow.
lectures and I help them with designing their own research, help them to prepare presentation for conferences and publications.
Do you really enjoy that part of your job, like teaching and investing into other dentists?
Yeah, I do. I don't know if they enjoy
Yeah,
it.
I'm sure they do.
I do. I do. I do enjoy teaching because we are learning together.
Mm,
There may be something that I don't know, then we say, yeah, let's find it out together. And we learn from each other. And I always try to find their own personal interest, not just, every stats and everything. For example, one of my residents, he has a nephew with autism. So
mm-hmm.
he really wanted to do research about children with autism or developmental delay problem, how
Wow.
to deliver better dental care or environment for the children with ASD, autism and developmental delay. So I said, yeah, if that's your interest and passion, let's do it. Let's
Mm,
research about it. So now he's developing a module for pediatricians, how to assess oral health for children with autism and refer to us so we can prepare ourselves to deliver the best care for those kids.
right. Yeah. I mean, that is, I'm sure, a very terrifying thing for a child in general. And
Mhm,
then having to treat someone that has autism or is on the spectrum, I cannot
mhm.
even imagine drills and everything, like, and just brushing the teeth is difficult in itself. That's incredible. That's so cool, man. So these are the kind of things that you get to be a part of too as a teacher as well.
Right, right.
Amazing.
Mhm.
Um, well, I wanted to ask you about your husband and your nonprofit organization as
Yeah,
well.
yeah.
We haven't talked about it at all. This is just information that I know from our mutual friend. So,
Mhm.
could you expand on that a little bit? Tell me a little bit more about the nonprofit.
Sure. So my husband started this nonprofit organization based in New York. Um, Short bio of my husband, he's a very unique person, I should say. So he's all about like a social movement, change the world, that kind of thing. And then he travels a lot. He traveled around the world a couple of times. And then what he found was he met a lot of young Korean, American, Korean, European artists and designer, architect, and they really want to contribute to the third world, how to giving out their talents. But for doctors and teachers, it's a little bit easier. There are many ways to help those kids. But for artists, because they don't even meet the basic necessity there. It's hard to like bring art stuff and doing art program there. So he saw the needs of the volunteer. They really wants to do something. And then he truly believed that art is the universal language of hope and expression. So he married those two needs. And then he bring a bunch of artists and designers to African countries. We started with Benin and then now Kenya. And then we started art programs in these very, very remote villages, like no electricity, no water. And then it was first time for them to see the brush and see the paint. And they started to paint out. And that was really fun and meaningful for us. And then I joined the organization before we get married, and then we got married, and I kind of took over the operation part of the organization. And now we are doing quite a lot of program. We start with the art, but now we are doing fashion design program and technology program, health education, and dancing and music program too. So looking back, it was very interesting because I had to give up my art because of
Right.
all the family situation and things. But now I'm working with like 200 artists delivering this art program. We're not making all these children become an artist, but we use art and design as a tool to communicate their feelings, their emotions and idea in a visual way. So I think God heard me in some sense, and then I become a doctor, but I still work in art world as well.
No, yeah, that's insane. Because the organization is it called M Tree? Is that
Tree, right?
yeah? So I knew that M Tree had a background in art and the
Mm-hmm.
creative arts,
Mm-hmm.
and so when you said that you gave up a lot of your dreams to be an artist, I was like
Right.
thinking already like. That's crazy because
Yeah,
now you're
right.
married and you're doing this nonprofit organization that does that. Um,
Right, right.
wow, it's so incredible that you get to kind of do it all. You do it all.
Right. And now that I just started from last year, I did art integrated reproductive health education for mothers and teen girls.
Okay, you have
So
to
the
tell me what that is.
yeah, teen pregnancy is really a big problem there
Sure.
in Kenya.
Mm,
So usually 14, 15, after their primary school, they got pregnant, and then that's it. They cannot go back to school, and they cannot have their own career. So we give them an option, and you have an option. If you really want to get married and have a child, that's fine. It's a cultural norm there. But at the same time, the parents, there is a strong desire that girls to finish a secondary school and even college and have their own financial independence. So
mm,
if you want, you can control yourself, your body, and then you can delay your marriage and having child later, maybe early
mm,
20s after you finish schools. And
mm-hmm.
then we teach them basic sex education, reproductive health educations through art. So we
Wow.
use art as a tool, like express your feeling when you have first period, express your feeling when you had a period and you didn't have a sanitary pad and you couldn't go to school. What
Mm,
kind of intervention and solution can we have so that you can continue your studies? And then we do a lot of scenario based learning. You know, what if this happened? What if someone asks you out? What if someone touched your body? What would you say?
mm,
And then we do that in a safe environment through the language of art because there's no judgment in art,
mm.
so that these girls can express their fears, worries, and concern, and ultimately empower that yes, I can say no if I want to say no, and if I want to continue my study, I can. So that's what we are doing
I'm speechless. That is
now.
amazing. How okay, how do you come up with these types of programs? Like, what is the process? Like, you see a problem and then you
Mhm.
find the solution? Is that how it happens?
um, I think both my husband and I, and all our directors and volunteers, have a strong desire that everybody has to have an opportunity.
Hmm.
So I think we are giving an opportunity through the tools of art and design, so
Hmm.
they can have an informed decision, whatever decision in life,
Right,
career,
right.
or getting married, or selecting majors or steps in life.
Mm.
But most of the time, and this remote villages and rural villages, there is only one question and one answer, and it's very much about survival mode, right?
Mm.
But we really want to expand their view and perspective that yes, there are things in life, there are things in around the world, and we can support in some way. We have teachers, we have a curriculums, and we want you to learn. So once you learn and you have the knowledge and power, you can decide, you can choose your life career and your philosophy and your value in your life.
Mm.
And then I think we are much rewarded by that kind of programs.
Yes.
So we are not generating like top, A plus students or top artist or fashion designer, but we just want to help them to question about things in life and then have a power to answer.
Yes. And
Mhm.
create opportunity to do so
Mhm.
in a safe environment, a safe
Environment,
space.
right? No judgment.
That is incredible.
Mhm.
Where do I sign up?
Join
Oh
it.
man. So you said you work with 200 artists, you said?
Yeah, so well, pre-pandemic, let's say
Uh-huh, uh-huh.
pre-pandemic, we usually go every summer. It was more like a summer program.
I see.
And 50, 60 artists, designer, architect, they
Mm,
join us and spend about 3 weeks in these rural villages. And we ran these kind of programs that depending on their expertise and professions.
I see.
But actually, pandemic was a great turning point and opportunity for us because we couldn't travel anymore. So what we did, we maximized our local staff who had degrees in teaching and all those, and then actually they make our program, the summer program, as a year-around program. So now we are an
Oh,
official after school program in these primary school in remote villages. And now taking a boat, we have to take a boat to go to the village twice a week. And they are teaching all these that we've been doing because they've been working with us like 5 years. And now
mm,
they are leading our program, that those local Kenyan artists and teachers are leading our program year around.
how
That
wonderful.
it was. So that was a big challenge, pandemic, but actually it turned into a great opportunity for us.
Right. So it's not something that it's like a constant resource that's available to them.
Yes,
And
yes,
it's not just a once a year kind of thing, right?
right, right. And we
Wow.
couldn't we couldn't figure out. I mean, we wanted to do year round, but we are based in New York and
Sure.
European
Yeah.
countries. So we didn't know how to do it. But once the pandemic hit, the government opened the door pretty wide because
Mm,
everybody had to take a year over in Kenya. And these
mm.
kids in remote villages, they have zero access to internet. So they were very open to any other external program, non-NGO programs. So actually the local government invited us as an official after-school program for these children.
Wow, that's amazing.
It is.
Man, God works. That's all I can say.
It's all about it. Yeah.
That's incredible, man. Um, sorry, I'm just in awe because I really had no idea. I had no idea really about anything about any of the M Tree organization either. And I kind of wanted to save that for you to kind of share with me as well. And I'm
Mm,
just and so amazed to just the creative arts aspect is very eye opening for me because I
mm,
personally have a heart for that as well. I
mm,
think um, if I'm honest, especially coming from an Asian American household, where I mean, I think my parents really did encourage me in the creative arts, but I know that there are a lot of young people that it's not as encouraged, if I'm honest, right? And so to be able to hear that the creative arts and art is being used in this capacity,
mm,
not just like oh draw something or like be good at painting, but really being
mm,
used as a tool to help people in a country that are not educated in the same ways that we are, resourced in the same ways that we are,
Mm-hmm.
is really truly amazing and eye-opening and so
Mm.
insightful. So I hope if you're listening, there are so many ways to use your talents, like that's what
Right,
this
right.
podcast is about, is like,
True, true.
using what you love and know, and making
Yes,
something out of it. And
yes. And you mentioned that much of the audience is like college students and post-college young adults.
yes.
I really want to share something that I'm 41 years old, so I'm not there. I'm far from college now. But looking back, you know what? It was just confused. I was just confused when I was 20, when I was in college, even graduate school, and always question about like, what's the next step? Am I in the
Mm,
right path? What classes to take, what major to take, which school to go, which career or which job. But you know what? There is not a single thing that I have planned actually happened. It was
mm,
all something out of ordinary
mm,
happened. But what I can say is for that age group, early 20, mid 20, I really want to encourage to try anything. And you have to learn about yourself first. I never knew that I liked dentistry if I didn't try dental school or start to see patients. I
mm,
never knew that I liked policy if I was not thrown into the policy world because of the financial crisis at that time. But I learned about myself. I mean, I always thought I'm an art person. I like art. That's all about me. But it was not true. I have other part of me which I haven't known at that time. But with ups and downs of the life, really opens a door for me to try some things that I never planned or thought before. And then I learn about myself. I'm still learning about myself. Oh, yeah, I like this one. Oh, yeah, I don't like this one. So I can plan the next step only because I know about myself at that moment. So what I encourage for all the listeners or viewers, I really try to anything without fear. It's the
mm.
time for try and error, 20 and 30s, and even 40s, I should say. Um, and then you are learning about yourself and you're kind of shaping your career one step, step by step.
Mm,
And then when you know enough about you, it's really easy to choose one or the other because now you have your values inside you.
mm,
So it's not about right and wrong. It's not about your parents' value or the majority's value, but your own interest and passion and value. Then when some opportunity comes, you may choose one career over the other, even though this job pays less, because you know you will be happy and you can make impact in community and possibly in the world, and
mm,
then you will be happy. And then you're going to the next step. There is no such job that you will stay 50 years.
mm.
So you're going to change your job constantly. And then you are going to make a decision, the better decision at that moment.
Yes, I think everything you just said, it was for me. It's my the advice for me, because
Oh,
I'm like,
yeah.
you know, um, I'm so very much like, oh, if I make a decision, that's it. But it's not what you're saying is you have to try and you have to be open because you never know.
You
You
never
never
know.
know. And nothing is absolute, right? Like,
Mhm.
and I love that. Thank you so much for sharing that piece of advice. I needed to hear it, and I'm sure there are other people that need to hear it too. Um, Helen, was there anything else that you wanted to share before I let you go?
The last thing I want to share, looking back, my teens and early 20s, I had a lot of financial crisis
Mm,
um, through my family situation. And for example, my college, I was in college for 8 years on and off.
mm,
So I had to work for 1 year and go back to college the other year. So it was not easy. It was not easy. Um, but it doesn't deform you. I want to say that it's your choice. You don't lose yourself, all those external challenges and downs, ups and downs. It's not easy. I have to support my parents. I'm still supporting my parents since early 20s, but it gave me a lot of strength. And how do I understand my patients better? Because of my past experience, I think. If I live again, should I choose that path? I don't think so. It was too hard. but looking back, I think I'm more well-rounded person because of that downs. And then I decided not to lose myself or dreams. And then I always surrounded by good community and good friends who always remind me of who I am and what my dream is about. So if any listeners or viewers are in difficult situation, feel like there is a wall like right in front of your eyes, look for friends, look for community. It's okay to take a rest, take a year off. It's never late. If you graduate 1 year later, 2 years later, if you find your first job late 20s, even 30s, that is okay. That is okay. And then you will learn about yourself. Don't lose yourself and values, and you will move on. You will move on, and you will do well.
Yes, I am learning more and more through, your journey and other people's journey that really, man, everything happens for a reason. And,
Yeah.
but it's hard to see sometimes, like when you're in it.
Definitely.
You know?
Definitely, yeah.
But yes, thank you so much. I appreciate everything you said today. I thank you so much for your time. I know you're a busy woman, and you're a mom too, and I'm just so
like any
grateful.
other mom.
Man, I was really educated today, so I really appreciate all everything you said. Would you be okay? I know that you're busy, but if there's somebody that maybe has questions about pediatric dentistry or policy or
Public
even
health.
M-Tree,
Mm-hmm.
would you be open to kind of speaking with them?
Sure, sure. Anytime. And I will also leave my email to you.
Awesome.
So if anyone reach out to you and want to know more about career path or any mentoring, then I'm happy to share my experience.
Awesome. Thank you so much again. Thanks so much for listening, guys. You can email me at podcastwigu@gmail.com, or you can DM me on social media and I'd be happy to connect you. Until next time, bye.
Bye. Thank you so much.
Thank you.